Welcome to today's episode of Mindful Medicine. I'm your host, Tracy Jones, and I'm here with Dr. Jim Schrenker. Today, we're going to give you an overview of what a chakra is. One of the things that you discuss is how sickness can sometimes begin at the energetic level, and then over time, you see it manifest on the physical level. So can you talk about that a little bit?
In my belief system, I believe that all physical disease has to start from the energetic level and work its way out. It can be very subtle. It's usually years to decades before it actually manifests as a physical illness. But if you look at the chakra system, understand that this is physics. We are energetic beings. Physics can prove that we're energetic beings. And out of those energetic points that we call chakras, information comes and goes. So think of a chakra as an antenna that is searching your entire environment to find the right wavelength or amplitude of energy that's out there. Once that antenna picks that up, then that gets transduced into the neurohormonal system of the body. So when information hits the energetic body, the body transforms that almost instantaneously into your neurotransmitters. Those neurotransmitters travel to the brain, travel to whatever part of the body, and affect a cause. So when you hear or you see or you're exposed to that energy, there is automatically a transduction of that energy or transition of that energy into a biochemical response. We know that. We've proven that. We've seen that in the lab. We've seen it in real life, and you experience it every day. You hear bad news. Where does it hit you? Is it in the gut? Is it on the shoulders? Is it in the neck? Is it in the heart? What part of that news corresponds with that chakra? So when we look at the major chakras, there's 7. It starts with the base chakra or root chakra. The base chakra is located in the pelvic area. Its energy is typically drawn as radiating down through the pelvis downward. Then you have the sacral chakra, which is somewhere between the belly button and the base chakra. Then you have the solar plexus chakra, which is right in the solar plexus of the thorax. Then you have the heart chakra, the throat chakra, the brow chakra or third eye chakra, and then the crown chakra, which is generally drawn as radiating up. So the base chakra is your grounding chakra. It goes down into the earth. The crown chakra is more ethereal, pointing up more towards heaven, so to speak. So you have those 7 basic chakras. Understand there's a chakra for every joint, and there's thousands of chakras scattered over your body, but those are really on-body chakras. There's other energy portals that are out farther, and you can educate yourselves on those. I don't really get into those much because I'm dealing more with a physical issue. But yeah, when you see a physical issue, you can tell, if you know what you're looking for, what chakra is involved. From there, you can reverse engineer. If that chakra is involved, then this is the lesson that it's trying to teach you. From there, you go into the spiritual and emotional balance that person needs in order to help heal that physical malady that's going on.
Okay, that makes sense. And I guess when you mentioned the antenna, I know this is very simplistic, but I guess part of a chakra or energy is if you walk into a room and there's someone in there and you just feel really uncomfortable.
Right.
Or maybe you feel very welcome and loved.
Right.
It's that energy, that antenna that you're talking about that is picking up on the other energy in the room.
Right. Exactly. And then you have people that are empaths. Everybody is an empath. Everybody is capable of feeling other people's energy at any given time. But there's certain people that are more open to it. And that's because their chakras are more open. They have more issues. We'll see somebody, if not daily, at least once a week, that comes in with an anxiety issue. And as you go through and you work things up and you realize that everything in the blood work and everything on the physical exam is normal, then you start listening to them. It's like, I can't go to Walmart. I can't go to these big box stores because I'm just overwhelmed with anxiety. what if that is just a wide open chakra system and you can shut those down or regulate those and kind of deflect other people's stuff? Everybody in the world has gotten near somebody and picked up on their disease. Everybody. You just don't know it. You're around somebody, they have something wrong, then all of a sudden, later that day, your shoulder starts hurting for no reason. Is that really your stuff or is it their stuff? So when you start getting things like that happen in your life, you just got to take a deep breath, take a couple steps back and go, okay, is this my body? Or is this just my body trying to communicate an imbalance in my energy system? And of course, you got to, at some point you need to seek help if it doesn't get better to make sure it isn't anything that is in the physical system, to make sure there's nothing wrong. So that's my disclaimer there. But yeah, I mean, if you can regulate the opening and closing of the chakra system, then you can live in this world much easier because it's not so daunting to be around people.
Gotcha. And I guess sometimes when you get so far into that physical symptom, you do, like you say, you have to acknowledge that.
Oh, absolutely.
You have to work to fix that. But then
right.
At the same time, teach and coach the person
right.
of how to work on the energetic
I mean,
part.
If I'm having a heart attack, you can do all the Reiki you want. Get me to the cath lab. Right? Let's fix the problem, save my life, and I'll work on the spiritual stuff later, So you got to prioritize things. So we always, here at this clinic, we are integrated. We always look at things, first of all, with the conventional eye. Okay, is what's in front of me, is it serious? Is there something I need to do about this? And then as you start peeling the onion, so to speak, you start coming up with this test is normal, that test is normal, this exam is normal, this study is normal, the MRI is normal. Okay, everything's normal, but he has these very real physical symptoms. That's when we explore the spiritual, right? We don't want to explore the spiritual first very often. We want to make sure that there's nothing serious going on. And that's the advantage of having an integrated physician, a functional medicine physician, a holistic physician, rather than just going to, the Reiki person or whatever. You kind of want to have that, hey, you got my back type thing to make sure there's nothing going on.
Right. And I think that brings up another point as well. One of our other discussions, actually when we were talking about thyroid issues, you were talking about how when you do have to go on something, whether it's a supplement or some other thing, you have to give it at least 3 months.
Yeah.
And we had a viewer write in and say, thank you for giving me that information, because you do get impatient
right.
and you want something to work so
right.
quickly. And I think you would say the same thing as far as the spiritual aspect. You're not going to just have a prayer or have a meditation and wake up the next morning and it all be fine.
No.
It's something that you have to work at over time.
Well, and I'm not, I don't know if you have to actually go in reverse steps of every problem that led to that. In other words, I don't know that you have to peel that onion all the way to the dirty core. I think sometimes you can get to the dirty core pretty quickly. But that energy was there to teach you a lesson that you failed to learn or failed to learn completely. So then it piled on another lesson, and then it changed the lesson over here. And hey, you're not listening here. I'm going to make this lesson here. And then finally, as my sister says, the universe drops an elephant on your head and you got a cancer, you got heart disease, you got diabetes. It didn't happen yesterday. This is decades of stuff that you haven't listened to. So becoming enlightened over watching a podcast or seeing a healer is great. But now you got to go back and learn some of those things that you just blew off in the past. So it's a process. What I've seen in 30 years is, and I'm going to take cancer as an example because everybody knows somebody with it. It's serious and it's potentially life-threatening. There's people that get cancer that die pretty quickly. Nothing works. They just die. Then there's people that they linger with it and they live with the disease for decades or years or the rest of their life. And then there's other people that are seemingly better pretty quickly and I don't want to say cured, but no evidence of disease pretty quickly. If you look at each one of those people in an energetic level, the people that die from it probably have more of an obstinate personality. I'm not changing. This is it. I hate them. They're horrible. I'm never going to forgive them. I'm eat up with anger. I'm eat up with fear. I'm eat up with something. And I'm not willing to change. Because by the time they develop the cancer, they've had every opportunity to change. They've had every opportunity to forgive, every opportunity to find love and not fear. And they've chosen not to do that. It's their choice. They have chosen to go down this other path. Then there's other people that kind of get it and kind of understand it and struggle with it, but work their way towards that end goal of unconditional love or work their way towards forgiveness. Those are the people that tend not to die quickly. They're working on it. The analogy that I use with a lot of things is, let's treat God as your CEO. And your CEO sees you. And you're a schmuck and you show up late and you're not doing your work and you make everybody else uncomfortable. You're probably not going to be around. Come on, let's come to my office. We'll talk. Except God's office is not of this earth, so they transition. And then you got the employee that shows up late, that's doing that you bring into the office and they're like, okay, I get this. I just wasn't told. I didn't know. Let me try to do this. And they're better. They're not great, but they're better. So you bring them in again and you talk to them and say, look, we need to do this. You set them up with a mentor. You set them up with an example of how we want you to be because you see a redeemable factor in them that they're going to be good if they can just figure it out. Those are the people that linger. And then there's other people that come in and they get it and they know it and they're good and they're star. But guess what? I need a new chair because my back hurts with this chair. As a CEO, great employee, what are you going to do? What would you do?
I would buy them the chair.
Right. You would enable them to do their job to the best of their ability. If our job here is to learn how to forgive and learn how to love, what point is it to go to heaven unless you just can't figure that out and you need a reset? So wouldn't you stay here and mentor them and train them and give them every opportunity? And the people that get it, wouldn't you say, okay, that cancer, it was a good lesson. You learned it. You moved on. You figured this out. Let's be done with it.
Amen, brother.
Yeah. So that's what I see. And I see it every day. And, how are you going to do that in a double-blind placebo-controlled trial? How are you going to prove that? You're not. So what's faith? Faith is belief without an example, belief without proof. And that's where faith comes in. Nothing we're saying is controversial. You got to love people. You got to forgive people. You need to eat clean. You need to exercise your mind and your body. And you need to have a purpose. Who's can't really question that. I mean, it's harmless. There is no downside to that. So when you're looking at medical therapies, you have to weigh what is the side effect of what I'm going to do versus the potential benefit. If the benefit is great, but the side effect is potential death, that still may be something you need to do. I'm going to die anyway, but the benefit is I may be cured of this affliction if I do it. So, let me just do it. But if you look at Reiki, if you look at hypnosis, if you look at any of the things that we talk about alternatively, there's no downside to a very small downside of costing you some money. And the benefit is potential, but the benefit is completely unknown, but the potential is amazing. So, when we're dealing with things like this and chakra balancing and energy and stuff like that, what do you have to lose? A few bucks, And the potential is it sparks something inside you by balancing that energy that you can change your life path and change your future. So,
Okay. Well, I have to say, I am extremely excited right now. I want to go, oh my gosh. So we will stop on this episode, but I want us to delve more into each one of these chakras and talk a little bit about them.
Yeah.
So we'll do that in some future episodes. And thank you for this talk today. And thank you for joining in today on Mindful Medicine. And remember, you are loved.